think my biggest piece of advice here is not talking about it is not going to make it go away, right? That is not a tactic. I've never seen that work. Not, I've been doing this a long time. Not talking about it and just kicking it down the road until, I don't know, a decade, 2 decades, it doesn't work. It's going to come back up in those decades or, 2 decades later. So talk about it early. Honestly, talk about it before there's really a need, right? So if you think about the difficult conversations we just talked about, let's take like medical care, for example, as one of them. If you talk about it before there's a specific need, it's a much different conversation than talking about it as you're in the hospital and you need to make a decision for discharge, right? Your time is limited, you're under a high stress situation, and you don't have years of opportunity to figure it out, right? The healthcare system is moving quickly. So talk about it early, talk about it before. I do this with my parents. My parents haven't even retired yet. They don't need any care. They're very independent. But we talk about it now because I want to talk about it before they need something. That way it's an easier conversation as we get down the road. Use caring language, right? There's a big emotions in those four topics we just shared with you. There are big emotions. There are big emotions in finances. There are big emotions in your medical care. There are big emotions in getting someone to stop driving. So be kind. Lead with the kindest. Come from a place of understanding. Try to put yourself in their shoes for a moment and how scary that might feel to be having that conversation. Also take small steps, right? We don't need to one day you just never drive again.